Good morning, everyone. With Chair's permission, respected Mahesh Sona sir and Chaitanya Somanshi sir, and thanks to my medical teacher Suresh Bhattad sir in pediatric and who guided me, Dr. Girish Mendarkar sir, for the pediatric neurology, and all senior pediatrician from the Latur city, because of whom I could stand here as a pediatric neurologist. So outline of my talk is mainly, it's a video-based presentation rather than theoretical things. There are few important definitions. Developmental delay, it means child is delayed from beginning. After the birth, neck holding is delayed, maybe the all four areas are delayed. Regression is child has attended all milestones at one point of time, let it be 1 year, 6 months or 1.5 years, and then child start regressing. Sudden loss, any vascular event or SOL, there will be a loss of achieved milestone in an acute condition. So these are the any vascular event, space occupying lesion or any head injury which causes the sudden loss. And there are few very important is the communication difficulties. What now all pediatricians sitting in the OP practice experiencing more than infectious, non-infectious things like autism, speech delay, ADHD. So now in pediatric, early means how much early? It is the first 0 to 3 years of the age. So it is the most critical period of the child development, and intervention means giving a child a variety of opportunities to experience, explore and play the things around. As Shilpa madam correctly said, how to deal with this situation. That's why very important to know about early intervention and red flags. What is mean by early intervention? It is an introduction of planned programming, deliberately timed and arranged in a order to alter the anticipated or projected course of development. Means if you are suspecting that there are red flag signs, you need to start the early intervention from day one. And what is the rationale? Because most of the brain development, brain growth, neuronal plasticity, sensory motor development, learning, cognitive learning, then language development will occur in first 3 years of life. So it's very, very important to know the red flag signs. There are few more definitions. Critical period of development, it is the stage beyond which learning is impossible. So you need to pick up a child of developmental delay before that. Sensitive period is the extended period of time where we can pick up and child can be improved. And neuroplasticity, as you know, first 3 years, there is a possibility if the child is developmentally delayed, you can increase the neuronal plasticity by exogenous stimulus or therapies or with medications. So our aim is to prevent the developmental delay and disability and overall burden of the society, that is the financial burden in even the financial stress on the country. Screening and identification of at-risk children, as we have the all neonatologists with us, stimulating the child through the normal developmental channels to enhance the normal development and independent functioning of the child, get the maximum residual capacity used during this period, and minimize the need of future therapies, special education and special schools, and increase the family awareness so that we can involve them in the interventions. And I'll show at the end of the video how parents can work for 6 to 7 years to make the child walk. So brain is the most complex structure which consists of 100 billion neurons at birth, and for one action we need 250,000 to 5 lakhs neurons at a time working for it. So those neurons that fire together, wire together, that is the principle of neurodevelopment. And this is the synaptic connections which we can observe at the birth. It's very few, but at 2 years this is a normal child. If there is no stimulation, there will be a gray area where child will be developmentally delayed if there is no stimulation, which we are seeing in a pediatric OP after the lockdown or post-COVID era. These are the high-risk kids which needs to be screened. I don't go into the list of it. Developmental delay, obviously the child is unable to accomplish the developmental task considered appropriate for the chronological age or not attended the specific developmental milestones for the expected times. This is a long list of developmental red flags. This is available in all textbooks. So instead of this, I'll go and focus more on this slide of what are the early markers of cerebral palsy which we can pick up in our OP. That is the slow head growth, means microcephaly. If child is not attending the head control, abnormal tone, child is not responding to the sound or call by name, no eye-to-eye contact, no focusing, no tracking on the objects, child is continuously irritable, child is having poor sucking, seizures, and extremely sometimes sensitive to light or sound, persistent of the primitive reflexes, cortical thumbs, early handedness. So this is the just slide to show this is a hypotonic cerebral palsy. Here you can see there is head lag is there. This is early handedness, board-like rigidity, abnormal tone, child not responding to the sound of the like वाटी जरी पडली तरी तो लक्ष देत नाही किंवा आईने बोलवलं तरी लक्ष देत नाही आहे. Then seizuring, then abnormal choreoathetoid posturing, ataxic gait, choreoathetoid CP, let it be unilateral or bilateral. So you can see this is a 6-month-old child. We'll see the video, and the head size is only 36. This is seizuring posturing. Any PGs are there, they can just observe the, and so this is the first child, same child which I have shown, microcephaly, no eye-to-eye contact, and at the end of the video, if you focus, there is abnormal posturing, and this was the infantile spasm, that is the myoclonic jerks you can see in that video. This is a syndromic child, microcephaly, abnormal tone, not focusing, very irritable baby, and this turned out to be a West syndrome. The same child, seizuring, that is spastic cerebral palsy, quadriplegia, but more in a diplegic pattern. Can anyone just want to say what is the abnormality? This is a 9-month-old child, approach which child is not able to hold the neck. So there is a head lag in a, when pull to sit posture. This is the extensor neck thrusting. This is again 6-month-old child, no eye-to-eye contact, not responding to the sound. Can we play the audio? Audio is there? So this is one more child, 1.5-year-old, completely spastic child, microcephaly, severe hypoxia, there is a sutural overriding. Same child in a like mother's lap. You can observe the seizuring, posturing in the both lower limb. So this child I want you to focus more because this child, parents were so hardworking. This was the choreoathetoid cerebral palsy, severe birth asphyxia, and advised not to continue with the ventilatory support or not to do much actively in this child. But still, if you see the result, successful story, you will believe that as there is no option that baby you have survived, but you need to give the all opportunities for this child for the early intervention and medications. This is again one of the quadriplegic CP. There is abnormal tone more on the right side. Hemiplegic, right hemiplegia. With one more child, no activity at all, completely hypotonic, not responding to sound. This has turned out to be Marinesco-Jagren syndrome.
And daily therapy ko aa raha hai?
One more child who is at 1.5 years, not able to sit on his own. It's diplegic cerebral palsy. We are trying that he will sit on his own, but unable to do that. So it is like hypotonia or a diplegic cerebral palsy.
देर लगेगी मगर सही होगा, हमें जो चाहिए वही होगा। दिन बुरे हैं जिंदगी नहीं, सब्र रखो सब सही होगा।
So this is a diplegic spastic cerebral palsy.
ये मत कहो खुदा से मेरी मुश्किलें
Look here. Arya. Arya.
कसं वाढवायचं sound आहे?
Philip.
I want this picture is very very common in your OP. Post lockdown it has suddenly increased.
Arya. Look here. Arya. Arya.
This child, I am trying to make her listen
Arya.
to me, look at me, but unable to do that. She's in her own world, only saying the
Arya.
national anthem
Look
with
here.
the tricolor flag, and that's
Arya.
where the parents and
Arya.
even teacher are like they're telling ki she's normal child. See, she is saying the words, but she is not responding at me when I am calling her. She is not looking at me, but she is continuously singing a rhyme, national anthem, tricolor, and she is saying yes, like salute. So this is the autistic spectrum disorder, and there is a history of excessive mobile use. This is a
Now
child
come
from
to
our
the-
own Latur district.
Now sang.
Smith.
Smith. इकडे बघ हे बघ. Smith.
मी ओरडतोय repeatedly I am trying to get his attention, still he is unable to focus on me, not responding. What is his
नाव
name?
सांग तुझं. नाव सांग.
Smith.
He is
Smith.
not at all
इकडे
giving
बघ हे
attention,
बघ.
no eye to eye contact.
Smith. Hassan. Hassan. Look here.
I
यहाँ
am
पे
repeatedly
देखिए.
calling him, even mother is telling look at the doctor, but he is not at all, but he is good in a study. So this is a high functioning autism. ज्याच्यामध्ये की they are unable to focus, not responding to call by name, not aware with the surrounding and repeated restricted actions.
10, 14, 13, 14.
Anyone want to like guess what is this?
19, 20.
I asked the child to fold the hands and not to move it.
10, 14, 13, 14. 16,
He is very restless,
18, 19,
fidgety
20.
movements, not able to stand. One more child.
ఇది కావాలి.
ఇస్తారా
Anyone observes? This is a child with hyperactivity and motor tics. If you see the head movements,
ఇవన్నీ చెప్పు
very hyperactive. You can see there is neck movement. So this child is referred to our OP with developmental delay, thinking it is a cerebral palsy. Known case of cerebral palsy they have referred, but suspecting there is no hypoxia, third degree consanguineous marriage. We investigated. You can see her speech is scanning speech and motor delay, and this was her MRI selectively showing cerebellar atrophy, and this has turned out to be Marinesco-Jogren syndrome, which we used to read this in our Nelson during our PG days. We are able to see this is a patient from Umarga. We have worked up in Latur itself and published in journals. This kid has been referred by many pediatricians from our Latur district. This is before treatment and after treatment. Anyone want to guess what is the like condition? Very simple condition. Suspecting metabolic, pediatricians send a tandem mass spectroscopy and like urine GCMS2, but turn out to be very, very normal. Yeah, surely. So this was very, but see, pediatrician did very basic workup, even the advanced workup like TMS, GCMS. But in few cases, we miss this kind of picture. This child is going to normal school, but he is hearing handicap. Now, we started early intervention. He is from Udgir, and this has turned out to be biotidinase deficiency. So treatment, obviously, it is a complete teamwork, as I said, and the major pillar is the referring physician or a pediatrician who is sitting in the OP and giving the red input. Okay, do I need to refer this child to a complete team? And obviously, the pediatric neurologist comes second, then the pediatric psychiatrist, psychologist, occupational therapists, speech therapists, and audiologists. 2 more minutes, sir. I'll finish within successful stories. So this is a early intervention. And this video again sent by the, it is about 45 minutes. The child which I said, choriothetitis cerebral palsy. So he now tells all, सर्व पाडे म्हणतो तो, cycling चालवतो, coordinated activities, and this is the purely home-based therapy for last 6 years.
17 threes are
And now this child is going to normal school.
very good.
Only he is good very orally, but teachers are cooperative, so he is under occupational therapy and still doing very good in with the normal kids. This is a very long video. One more video.
देर लगेगी मगर सही होगा, हमें जो चाहिए वही होगा। दिन बुरे हैं, जिंदगी नहीं, सब्र रखो, सब सही होगा।
Help of the pediatric orthopedic clinic, and after operating now the child is independently walking and going to normal school. This is only one successful story of autism spectrum disorder. This child was very, very cranky, hyperactive, very hyperactive. Came from the US to our Hyderabad unit. In 2018, this is a 9 months. So our therapist is trying to calm him down. Day one, they give a lot of sweating to the therapist to manage such kids. Very, very restless. This is one of the symptoms of restrictive, repeated restrictive behavior. That is the autism symptom. Speech delay, social communication delay, and RRB. Is repeating self-hitting. Now, if you see after 2 months, child has calmed down, able to do the coordinated activities, energy level has come down. These are the wet cups what we use to calm him down sometimes. Now he is following the one-step command. Even he is doing the task said by the therapist. He is the occupational therapist who is working on him. He is giving now eye-to-eye contact. For therapy, he is very cooperative, giving a handshake. So I don't go into the details. There are many stories, but one is this one gross motor delay.
Excuse me, sir. Sir, please stick up to time.
Yeah, done. So just want to say thank you to complete IAP Latur, all my senior colleagues that I have been awarded with this. Just on 4th of Feb, they will be giving me this award for contributing to the child neurology. And I'm very much thankful to my pediatric teacher, Bhattad sir, and all IAP Latur who made me a pediatric neurologist. And to achieve this before 50 years, this award usually they give it at the end or after 50 years. I could get it at the age of 42 years. So thank you, thanks everyone.
Thank you, sir. We all know that the visual impression is always long-lasting. Thank you, sir, for showing us a drishyam of interesting cases. So I request Dr. Sunar sir and Somvanshi sir to felicitate Dr. Prashant R Utage sir. Sorry, I request Dr. Sunar sir to conclude the session.
Thank you so much. I congratulate you first of all, Prashant, for this latest award and this fantastic lecture today. Developmental delay is a very vast topic, and it would require a whole day if you go on discussing. But he has tried to cover it in a very short time, and he has told us the importance of early detection and maximizing the residual capacity, and tried to cover the pathologic process. Then he has enlisted signs of developmental delay and soft signs like cortical thumb, handedness we should pay attention to. And I must mention that he has demonstrated very nice video clips and pictures that were taking us to the scenario. and very interesting case about biotinidase deficiency. So the message from this talk is we should not restrict our vision to only cerebral palsy, but look holistically at developmental delay children and give them maximum help as early as possible. Thank you for this lucid and fantastic lecture, Prashant. Wish you all the best.
Hello.